Hello everyone, I'm Dr. M. Madhavi, consultant, obstetrician, gynecologist, and laparoscopic surgeon from KIMS Cuddles, Secunderabad.
Yeah. Hello everyone. I'm Dr. Mahesh Gudelli, working as a consultant clinical and interventional pulmonologist at KIMS Hospital, Secunderabad. So, yeah.
Today we have come up with a new topic. I welcome all of you for this session, which deals with respiratory infections in pregnancy. Now, why are these respiratory infections so common, especially it's a winter? So mother is prone for all the respiratory infection, and all the more as there is a dip in the temperature. At the same time, with the pollution going up day by day, the infections are increasing. Now, why are we so concerned as to all the pregnant women? Because their immune system is very uh, reduced, and that is one of the reasons. And as the pregnancy grows, there is expansion of the abdomen and the lung expansion that is compensated. So these are few of the things, and Dr. Mahesh will tell us as to what care and a little about the respiratory infections.
Yeah. Thank you, ma'am. So, the thing with pregnancy is what we have to understand. Pregnancy by default is a immunosuppressed state. Any pregnant female will have their immunity in a low level. So what happens, they are very much prone for infections, any infections. Now why is it important for us during this winter? This is purely viral season where viral infection, cough, cold, it's very common. It will happen to everyone, but the chances of a pregnant female getting this is very fast and very easy. And the severity can also be, where we can't even assess that rabbit, the infection can increase. So in front of our eyes, the pregnant females can become bad. So why is it important for us? So what precautions we have to take, and what is the main treatment even if someone gets this infection? That is our main area of interest as today. So we know that pregnant females are very much susceptible for these infections. So what are we supposed to do? First and foremost thing is always prevention is better than cure. So what we'll do is, what we are doing at present is, any pregnant female always vaccinate with a flu shot. Yearly there will be change of flu vaccine. Yearly the strains are changed. Yearly the vaccine composition is changed. So what we are going to do is, in every pregnant female around 28 weeks, you give a flu shot. That will uh, you know help them to form antibodies against that particular strain of virus. Then second thing, avoid gatherings, avoid any functions, especially during this winter season, especially for those who are very much susceptible to these infections. So even if you are compelled to attend these events, always wear a mask. Again, pregnant females wearing a mask, they feel very suffocated, but then also that is a better option. Then God forbid, if someone has this flu, someone got infection, some pregnant female, what are you supposed to do? Again, antivirals are safe. You are supposed to give antivirals. The only antiviral what is available at present for common flu is oseltamivir. It is available with the brand name of Fluivir. So that can be given twice daily. That is safe in pregnancy, right? So this is the main thing what we address in pregnant female. Then even in pregnant females, they are more susceptible for bacterial infections also. Post viral bacterial infections can also happen. So when are you supposed to start antibiotics? See, what we generally see in OP, our own OP, is a person comes, a pregnant female comes, they'll be having some infection, they'll already be on antibiotics, which is not needed. In flu, in winter season, when you are having cold, that is not an indication for starting antibiotic. Wait, give adequate supportive care, take steam inhalations, take some antihistamines, and paracetamol if you are having fever. These are enough. And adequate hydration. Hydrate and hydrate. This is mandatory. Then after 5 days also, if you're having fever, then you take antibiotics. What are the antibiotics which are safe in pregnancy? Penicillins and cephalosporins. These are the only antibiotics which are relatively safe in pregnancy. So this is how we follow in pregnant female. Now I'd like to ask ma'am, anything you want to add ma'am, on this?
Yeah, most of the time, as you rightly highlighted, a mild infection in most of the patients for normal adult, they recover well. But because the immune system is little suppressed and compromised, they suddenly go into a very
Yes.
fulminating or very sick
Very sick
situation.
state.
So that all the family members and the care providers should be aware about it. And as soon as they get the infection, we should reach to the healthcare provider. Now, apart from this, most of the time before the patient comes to us, at home, little of pepper, milk, and all these home remedies are given. So, do you recommend those home remedies, and what is the basis of those remedies, or what would you say?
Again, when it comes to home remedies, that is generally there is no evidence based thing which is backing up these home remedies. But the advantage of home remedies is we take steam inhalation. So what happens, you will have some decongestion, your nasal airways can get cleared up, your throat can get cleared up. So what happens in those situations is, at least you feel that your breath is better than what it was previously. Then pepper, all these things are, they are more of spicy things which what it does is, it acts like a decongestant, more or less it acts like a decongestant. So all that airways will get opened up, all the sinuses, nasal airway will get opened up, and you apparently will have a feel that your breath has become better compared to before you use them. That is the main basis of home remedies. But steam inhalation and adequate hydration, these are the most important things what we see. Again, steam inhalation means not like taking on going on taking it only 3 or 4 days, that much.
And adding to that, the rest also.
Rest, yes, rest,
Yes.
obviously rest, yeah.
Yeah. And why are we so particular that all the infections to be treated in pregnant women? Because there is more risk of low birth weight babies,
Yes.
preterm deliveries, and these infections can be definitely transmitted to the fetus. And the fetus may have some, later in life, may have some learning difficulties and long term impact, which are
Yes.
really not, favorable for the fetus. So these are the impacts why a pregnant woman, any infections, respiratory infection in pregnant women should be immediately treated. And as you rightly said, we are giving flu vac or the vaccination for influenza for all pregnant women between 28 to 32
32
weeks.
weeks.
So, all the ladies, I request all pregnant women should get vaccinated for flu, so that after delivery we have seen more perinatal morbidity and mortality.
Yes, yes.
Because earlier days, we remember that the baby mothers would not attend the follow up clinic after delivery because their child is already admitted in an ICUs
NIC.
and they are undergoing treatment for the respiratory infections. The incidence has definitely come down due to the influenza vaccine. So that is a very good thing. Doctor has advised about the vaccination. Can you add something more? Incidence, can we just start with, like in US they say almost about 49%. So I was just going through, almost it is coming to 29% in India, the incidence of respiratory infection. So it is definitely there. So we need to vaccinate all the women.
So coming, adding on to that, see, incidence is always more in India because a lot of cases are underreported. They won't come forward and report that they are having
Okay.
cold or cough or something. But like madam said, what you have to understand here is, always a healthy mother gives healthy child. That is most important. Prevention is better than cure. Take vaccine, prevent as much as possible. Even if you get it, we are there to take care of that. But especially in pregnant females. As madam said, always attend your healthcare provider so that they can assess you, they can assess the severity of your disease, and then we can act accordingly. Most of the times it is mild disease, but incidence of flu patients becoming bad is more in pregnancy compared to a normal adult patient. That is what we just wanted to highlight there.
Yeah, there could be the duration of the disease could be upper respiratory infection most of the time about 1 to 2 weeks.
Yes.
If it goes into a very severe thing, which may require admission also. So on an average, about 14 days is the duration of
Yes.
the disease, and we should immediately, as early as possible, we should attend to that. So we welcome you to this at KIMS. We are providing all the healthcare facilities, taking care of the neonatology, high risk pregnancies, having all sorts of laparoscopic surgeries, minimal access surgeries, and a very good medical ICU with the good ventilator backups, and also kindly come to KIMS Cuddles. For all pregnant women, we have a safe delivery.
Thank you everyone. We are ready to take any questions. Yeah.
So, the first question is: are respiratory infections more dangerous during pregnancy, and are there any home remedies that are safe for treating respiratory symptoms during pregnancy?
Yeah. So definitely the respiratory infections are more dangerous during pregnancy because, see, already when you're pregnant, your breathing will be shallow. You'll always have a constant feel of breathlessness. So on top of that, there are respiratory infections, your lungs are compromised. Definitely you'll have more symptoms, and automatically your, see, if the disease is becoming severe and your oxygen levels are dropping, then automatically the oxygen level going to the baby in the womb, that will also drop. So definitely respiratory infections are more dangerous during pregnancy. And coming to the second part, are there only home remedies? So again, mild disease, steam inhalation, some decongestion, and supportive hydration, rest. But again, before starting these, you better visit your healthcare provider, because whatever may be the thing, it is very difficult for you to assess the severity of the disease, but it is day in and day out job for us to assess all these things. So if it is mild, we will only advise for you to take rest, home rest, take adequate hydration, take whatever medications are needed. And if it is say moderate or severe, we will only assess and we will only admit you to take care of both you as well as child. So that is the most important thing. Before starting anything, visit your doctor, then take a call. Whatever is needed, you have to do that.
Because you get the proper evaluation of
Yes.
your health status
Yes.
and the severity of the
Severity of the
illness.
disease. Yeah.
And it could be as a on an outpatient depending on the severity.
Severity.
Yeah. The other question is it safe to take antibiotics or antiviral medications during pregnancy?
Yeah. So antiviral medications are safe. There is no doubt about that. You can take that, but what antivirals we have at present is only oseltamivir. That is the main antiviral. What is there? Again, it is going to work only for H1N1, whatever we call it as swine flu, and influenza. These are the viral infection which has antivirals. But most of the viral infections, it takes time. You just need to give it some time, give adequate support to the body, then slowly it will subside on its own. And like recent past, we saw the pandemic, COVID. Again for COVID, we don't have adequate data 100% proving that some antiviral is not safe. So there also, depending on severity, we will give antivirals. But for mild diseases, nothing is needed. Adequate rest and hydration and supportive care. And antibiotics. You should not use antibiotics for every respiratory illness. If it is simple flu, simple cold, just only supportive measures. If your fever is persisting beyond 5 days, that is when we suspect bacterial infections. So, what are the antibiotics which are safe during pregnancy? Beta lactams, penicillins, and cephalosporins. These are the safest, most safe drugs during pregnancy, and to an extent we can give azithromycin. Other than this, no other antibiotics. So again, taking a call about antibiotics and antivirals is depending on severity, depending on your symptoms. We have to take a call, not like over the counter medication. You have to come to us. We will only prescribe. So don't overuse them. That's it.
Yeah. Can I add little more
Yeah.
that there could be, if a patient during her pre-pregnant state, she's an asthmatic or having, or she is on antitubercular drugs. Can you just throw some light on those two respiratory
Yeah.
conditions during pregnancy?
So first thing is TB, most common in India. We don't know who will have TB or who won't have TB. Say if you are already tubercular patient, you are taking anti-tubercular drugs and you became pregnant, nothing to worry. All the first line tubercular drugs are very safe during pregnancy. They can be given at any stage of pregnancy for whatever duration it may be. There are four first line drugs. All the four drugs are safe during pregnancy. Even our regimens won't change to a non-pregnant and to a pregnant female. So tubercular drugs are very safe. Then second thing, coming to asthma. So asthma, the most common things what we give to pregnant females or any patient is inhalers. So inhalers will have uh, microgram dose of corticosteroids. So when we uh, prescribe inhaler, the first question what we get is, sir, steroids are not safe during pregnancy. Why are you giving steroids now only? No, nothing like that. We are giving in micrograms, which will act locally. The systemic absorption, the amount of drug which enters into blood from inhaler is literally negligible. Majority of the drug acts locally. So local action of steroids is most important in the airway. Say, suppose following this myth, you didn't take inhaler. You are having moderate to severe asthma. Your oxygen levels are low. You're constantly having air hunger. So what happens? Ultimately, your baby is going to get less oxygen. They'll have uh, growth retardation. They won't have proper cognitive development. So always treating asthma adequately in pregnant female is very much important, is of first line importance, and you are supposed to take inhaled corticosteroids. Whatever may be the case, there, see, or not taking steroids, not taking inhalers will get addicted to this. All these are myths. Don't trust them. Taking inhaler and putting having adequate asthma control is a mandatory thing in pregnancy.
Okay.
Yeah.
Yeah, that's
Okay.
so elaborately you have explained it. And other questions, yes. When most common symptoms of respiratory infections in pregnancy, and when one should see a doctor?
Uh, so when
Commonest symptoms.
Yeah, so symptoms won't change much. Again, to a normal patient and a pregnant female, the symptoms are going to be same. They'll have fever, cough, nose block, headache, early morning sputum, throat irritation, all these things. So when you have all these things, visit your doctor immediately. That is my first suggestion, especially in pregnant females. Don't hesitate. Don't take a back step saying that I'll visit after 2 days, I'll visit after 3 days, nothing like that. You visit immediately, so that we can see, we can mainly assess how severe the problem is, how severe the symptoms are, so that we can treat them adequately. So two things, symptoms are going to be same, and when to visit doctor is immediately you have symptom, you visit the doctor.
Are breathing exercises safe during pregnancy?
Yes, 100% safe. No hesitation about that. You can take deep breathing exercises, because as the tummy grows, as the uterus grows, baby occupies majority of the abdomen. So the breathing capacity of mothers will decrease, because everything all the chest, all the abdominal contents will be pushed up. So these deep breathing exercises can help you 100%. There is no doubt about that, and they are 100% safe in the pregnancy. uh, Again, there are adequate exercises for pregnant females also, so no worries about that. They are all time tested and proven with the base with evidence.
Yeah. Will my baby develop a stronger or weaker immune system if I'm frequently sick during pregnancy? That means they want to know
Yes.
what is the impact on the fetal immune system. Will it be strong or weak?
See, first line what I have told is healthy mother gives healthy child. So if you are having frequent infections, you have to address why you are getting frequent infections. So always prevention is better than cure. If you are always sick during pregnancy, automatically it is going to affect your baby. They'll have some growth retardation. They'll have low birth weight. So automatically they will cause their own problems. So sick mother gives sick baby. That much I can say. So prevent, you assess, you address why you are becoming sick. What is the reason for your sickness throughout the pregnancy? Is there any nutritional imbalance, or are you having any other immunosuppressed states? So these things you have to address. So once these things are addressed, automatically your sickness will come down, automatically baby will be healthy.
Okay. If I have infections during pregnancy, should I prepare for early labor? As I rightly said, yes, there is a risk of preterm delivery, small for
Yes.
gestation. That is what again and again, doctor is emphasizing on the fact: less oxygen to you, less oxygen to baby, and that will have an impact of leading to preterm delivery, small for gestation, low birth weight. These are the complications you are exposed to. And what follow-up care should I watch out for?
Follow-up care. See, in pregnancy, the most common thing what we follow, yeah, both gynecologists, all the obstetricians, what I saw is, always encouraging pregnant females to have adequate nutrition, adequate hydration, and take proper precautions. These are the main things. And follow-up care is going to be standard, high protein diet, and adequate supportive care, proper nutritional balance. These are the things what we see in follow-up. Anything to add?
Yes, you should be under close supervision, and in case as for the chronic respiratory diseases, you should have a proper, pulmonology consultation as to when to reach the doctor in emergency. All
Yes.
these things are very, very important. And many a times in a family, if someone is taking anti-tubercular drugs, they tend to tell that this will have impact on the baby, and the mother suddenly stops her anti-tubercular
Yes.
treatment.
Yes.
So all these things, please don't take any decision on your part. Kindly come to the healthcare provider, and they will definitely guide you the way it has to be treated. Can my baby be born with respiratory issues if I had infections during pregnancy?
See, respiratory issues. See, it is a very wide topic. To say in a simple terms, it is very wide topic. Irrespective of whether you have respiratory infection or not, or whether you are having other infections, or whether you are having other diseases that will directly have an impact on baby. It need not be only respiratory illness, it can be some other thing also. So low birth weight babies, they'll have some or the other problem, especially during initial times. Then coming to respiratory issues, few babies what generally evidence throws light on is they'll have some respiratory issue. They'll have childhood allergies. They'll have childhood asthmas. What we see frequently, they get triggers. Even with small trigger, they'll have symptoms. So that is again a second part. That is after pregnancy, after delivery, after as child grows. So we should not think that far ahead. we should think even before that. We should, our target should be so that you should not reach such a stage. That should be our main aim.
I think that is the role of flu vaccination.
Yes.
As
Yeah.
I again emphasize on the fact that all pregnant women should take flu vaccine, and definitely we have seen less number of admissions in NICU because of the respiratory infections in the
Yes.
newborns. Are there any advanced treatments available for the chronic respiratory infections to cure rapidly?
That depends on the type of infection, to be frank. So
Maybe the
yeah.
severity, where you can some CPAP and all that, which are what you would like to add
So
on to.
once say if a pregnant female is requiring CPAP for a respiratory infection, or it is a very advanced respiratory infection, it will directly have impact on baby. So generally what we see, very bad flu cases in pregnant females where they land upon CPAP or ventilator, we tend to terminate the pregnancy very fast. Okay, say uh, if it is a term pregnancy about 28 weeks or 32 weeks, uh, what we generally follow is doing a cesarean section, delivering the baby, taking care of the baby in NICU. And then once baby is out, automatically mother's immune system can also reset. They'll better respond to whatever treatment we are giving.
Okay.
So once it is a advanced or severe disease, then that is a different ball game. At that time, if it is term pregnancy, we take care of baby as well as mother. But if it is not a term pregnancy, always mother is a priority.
Can you throw some light on SARS, severe adult respiratory syndrome?
Yes. So this is in a simple way. SARS is nothing but ARDS. ARDS is like full blown respiratory illness. Whatever may be the viral infection, you have whole lung involved. So once your whole lung is involved, automatically your oxygen is going to drop to a very bad level, and where immediate ICU admission is needed, where you may, pregnant female can land upon a ventilator. If such a situation arises, again, it's, uh, we tend to follow what guidelines we follow here is term pregnancy, deliver the baby, terminate and take care of baby. Not a term pregnancy, terminate the baby, terminate the pregnancy, then do adequate ventilator management for the mother. You know, it is like a full critical care management where we use ventilator, where we may have to, give ventilator in a prone position. So that is like a severe ARDS management. So again, once any pregnant female reaches that stage, it is very difficult to take, to save the baby. Basically, at that time, all our resources will be on mother only. So let us not, our target is to prevent that. Our target is not to let any female, any pregnant female reach such a stage. That is the main thing. But once ARDS has set in, the management is going to be same for even a pregnant female as well as a normal patient also.
Okay, so here we see that a mild respiratory infection can change to a moderate and then go to a very severe condition, and the mother can have serious sickness. So here at Cuddles, we have all the intensive care with all the backups, medical care, surgical care, neonatal backup at Secunderabad, Kim's Cuddles. Thank you for the patient hearing.
Thank you everyone.